Systemic sclerosis, it's actually an autoimmune disorder of connective tissue. Here fibrosis occurs and skin, internal organs and vessels they are involved. So Raynaud phenomenon is almost always present, whereas in case of skin, scleroderma and digital ischemia, they are mostly present. Lung, cardiac, gut and renal disease, they also occurs. The disease most commonly present in 4th to 5th decade of life, and the female to male ratio is 4:1, so it's most common in females. There are two types. One is the diffuse cutaneous systemic sclerosis and other is the limited cutaneous systemic sclerosis. It accounts for 70%, where this is responsible for 30%. Older age, diffuse skin disease, proteinuria, high ESR and pulmonary hypertension, they are responsible for poor prognosis. Now let's talk about the pathophysiology. So here we have two components. One is the genetic and other is the immunologic. So genetically it is associated with certain specific alleles at the HLA locus, whereas immunologically helper T cells 17 subset, they infiltrate the skin and causes abnormal fibroblast activation. They are responsible for increased production of extracellular matrix, and as a result we have scleroderma. In case of vessels, arterial and arteriolar nerving occurs, and it is due to intimal proliferation and vessel wall inflammation. Next, Raynaud phenomenon is our universal feature, and now we are talking about the clinical features. So skeletal muscle involvement, here we have arthralgia, flexor tenosynovitis and muscle weakness and wasting. In case of gastrointestinal involvement, we have smooth muscle atrophy and fibrosis, especially in the lower two-thirds of esophagus, and it is responsible for erosive esophagitis. If stomach is involved, then early satiety is seen. In case of small intestine involvement, malabsorption and bloating is present, and if dilation of bowel occurs, then pseudo-obstruction can be present. So if renal involvement occurs, then hypertensive renal crisis can occur, and it most commonly occurs in diffuse cutaneous systemic sclerosis. And now a very important, if skin is involved, then we have non-pitting edema, and it causes the skin to look shiny and taut, and the distal skin creases, they disappears. Capillary loss occurs if neck and face are involved, then lip thinning and radial furring are present. Skin thickening stops at this point, and if it is distal to elbow and knee, then it is limited cutaneous systemic sclerosis, and if it is proximal to elbow and knee, then it is diffuse cutaneous systemic sclerosis. In case of pulmonary involvement, insidiously evolving exertional dyspnea is present, and signs of right heart failure can also occur. Now let's deal with the investigation. So we are going to investigate for the hematology, RFTs, LFTs, BFTs and lung function tests. Urine analysis are also done. ANAs, antibodies are also checked. Next, checks X-ray can be done, echocardiography. If interstitial lung disease is suspected, then a high resolution CT can be done, and if pulmonary hypertension is suspected, then right heart catheter measurement is done. Barium meal and hydrogen breath, they can also be done. Now management, very important. For management of Raynaud phenomenon and digital ulcer, calcium channel blockers are given, IV prostacyclines can be given. GI complication for esophageal reflux, proton pump inhibitors, anti-reflux agents can be given. Bacterial overgrowth, rotating course of antibiotics is done. Pseudo-obstruction, metoclopramide and domperidone can be given. Hypertension, for hypertension, ACE inhibitors. If joint involvement, analgesics and NSAIDs can be given. For progressive pulmonary disease, Busantan can be given, and heart, lung transplant can be indicated. Next is interstitial lung disease, so glucocorticoids and cyclophosphamide can be given. So that's all about systemic sclerosis. If you like this video, click on the like button, and also thanks for watching this video.